Hey, you two. I hope your day is going well. Today is Monday, August, I think it's 25th. Yeah, August the 25th. And it's about 10:30 in the morning. And yes, I do have my little dogs here. This is Lily and Lilac here. And the reason why I have them on my lap, they were just running around when they sensed I was going to go on my computer. They don't like mommy being on the computer, but I really needed to get this off my chest and I wanted to share with you guys. It's kind of personal, and so I like to find out what what your experiences are and how you're able to resolve your situation. What I want to talk about today is our parents. And I have my mother's still alive. She's 85 years old, 85 and a half. And she's considered what they call a healthy and a youngish 85 and a half year old, meaning that she's mobile, she can walk around, um, she could cook for herself, she still drives, etc., etc. But again, I noticed that there are some differences. For past 1 year, um, her memory isn't as sharp as it used to. But whose is? And I know my memory is short-term memory gets affected, but it's just it's getting a little bit more pronounced. I think with my mom, like for example, I saw her yesterday and like she'll indicate something on the her calendar, let her know when her appointments are, medical appointments or anniversaries, things like that. And she indicated like she had a sister who passed away almost 50 years ago, and this particular sibling of hers is like 11 months younger. But she indicated on the calendar that she would have been 73 years old if she's still alive. And my sister noticed it on the calendar. So she asked our mom about it. Hey, I see that you said, on so and so is going on 73. And my mother looked, and then my sister added that, that your sister is only 1 year younger than you. So her mother responded, "Oh, so how old is she then?" So my sister replied, "Well, mom, how old are you? You know how old you are." And I think she might have thought for a moment, and I think she gave the right number, 85. So then my sister said, "Okay, so how old would she be if she's only 1 year younger than you?" And then she said, "I don't know. You have to tell me." Now, my mother is a very smart woman, um, but response like that, you start to wonder. And there are other little things like she puts something in the microwave, and she gets distracted. She might say, "Oh, let me just put it 1 more minute just to get it warmer," and she'll walk away and she'll forget that she put her coffee in there. Now we've all done things like that, and I've done things like that. But it seems like as time goes on, the type of things that she does it's becoming more questionable. She does have pernicious anemia, which means she's not able to absorb B12 normally. So every month she has to go to the doctors and get her B12 shot. Okay, and she does go. One time she missed a couple of months. So what I did, I bought her these sublingual B12 shots. Because when I learned that she had missed an important B12 appointment for over a month, I was concerned, and so I brought over a 6 month supply of sublingual B12. Those are the B12. You put it under your tongue. You don't swallow it, and your body absorbs it. So it bypasses the GI and goes directly into the um, bloodstream, so she could get a B12. Without B12, it it can cause severe neurological disturbance, problems. Um, and yes, it definitely affects memory and severe form of B12 deficiency. You literally will go mad, and and they cannot, once it gets to that level, you cannot reverse it, you know. So knowing that I bought her the bottle, 6 months supply, and told her, I said, look, at next, your next appointment, give me a call, I'll go with you, things like that. And, but she made that call, and so that's one of my concerns. And when I did see her yesterday, um, I noticed like my mother's Caucasian, and she, um, I noticed like her forearms here. She's my mother's slim and everything. She's not overweight. She's normal body weight. Um, but I noticed like in her skin, like from this part down to her hand, when she was standing up, when she's in front of the window, the sunlight was going through, and it gave a different. Her skin color looked weird. It didn't look like how I usually see it. It's like this colored. She does have what they call aging spots, and but even beyond that, it's like it's almost has like a grayish color. It looked weird, and I mean how the sunlight would shine through. It almost looked almost translucent, almost this part. It looked weird, and I noticed like from her calves down, also it's slightly discolored, like a slightly darker color, and some of the pigments like slightly spotted, a paler color, but the overall, down, below the calf, it's darker. Like it's weird, and it's some drying on the skin as well. Now, as for my father, if I forgot to mention, my father passed away 5 years ago last month. He had diabetes and everything that is associated with it. But I noticed like before, it might have been like 11, 11 years ago, I noticed his skin, from his extremities, his calf down, that also was like that slight discolored, and then the slightly mottled texture to the skin and drying. And yes, he did have very poor, he developed very poor circulation and neuropathy. So with regard to my mother does not have diabetes. She does take meds for blood pressure. Um, Her blood pressure, when they initially prescribed the prescription to her, it was just slightly high. You know, it might have been 124 over, you know, over 80. But it was just slight. But they felt that they, as protocol, give her the pressure meds, whatever. She takes it religiously, you know. But other than that, well, my concern is, you know, um, I'm concerned about her memory, and I'm concerned about, the circulation, the discoloring in the skin, and what I should be aware of, and what I should tell my mom. Um, Also about, I'm trying to like think ahead. My mother does live alone, and um, she has, her children. We come and visit her. Have a brother that lives just like a mile away, and see her. he sees her almost every day. So I'm concerned, like when her memory, if her memory starts to get worse, you know, how how should we handle this? What type of services are there out there? You know, what test, if you know of YouTube that I could suggest for my mom to take regarding her memory. And, and again, let's just say the worst could happen. Alzheimer's disease. How do you handle that? How do you handle about taking care of a parent, making sure they don't get hurt? Um, my mother, she doesn't want to. She's very independent spirit, and I don't want to take that away from her. You know, I did suggest. I said, Mom, you live alone in this big house. You know, to get it prepared for, to sell it. And this was made mention of the year my father passed, which was 5 years ago. And I thought then, you know, um, when my father did pass, that we were going to, couple pack of things, and she was thinking about living in a like a single unit place, a little rental or something. It's just like a functional kitchen and a bedroom, and that's it. But she does. I gather with current conversation with her, she does not. She does not. She's not ready to move, and she does not want to pack up things. She starts to get upset, and she starts to cry a little bit. When I uh, push the issue. So I saw that, hey, she's not ready, and I don't think she's ever going to be ready to move. She's, this is the house that I was raised in. She lived there over half of her life, about 40 plus years, I think. She's been there. And so I want to really know what could I do for my mom. So the transition for her, I just want my mother happy and comfortable, and I want her safe in the house. And um, part of initially I thought when my father passed, I initially thought oh maybe I just move back home with her. I live an hour and a half uh, minutes away from her, and so when the weather's bad, it could be kind of challenging coming to see her. But initially, I thought, hey, maybe I could just, move back with her, or stay with her for the weekend. But I started to develop a condition, unfortunate. I get anxiety and panic attacks. I used to live there, and there was a robbery, and I was home at the time. I saw the burglar. It was kind of frightening, and sometimes I had a panic attack there in front of my mom. So I'm get kind of fearful sometimes going back there. So I'm presenting it to you too. What I can do for my mom. Those people who might have older parents, and what do they do? What advice? What did they learn? The caretakers about how to make the transition for your older parents, so that they're comfortable until their last days. So this is my situation, and I am a little sensitive about it, and I just want to make sure I do the right thing, and get your advice. So let me know, you two. Take care. Bye bye.